My name's Linda Vernon and I qualified as a physiotherapist from University College Dublin in Ireland back in 1996. Since then I've done a lot of other additional qualifications and training, and I now work as a digital leader for Healthier Lancashire and South Cumbria, which is the integrated care system in Lancashire and South Cumbria. And my role mainly involves empowering people, that's the public, citizens, patients, to manage their health with the support of digital technology. When I graduated as a physiotherapist, I expected that I would end up doing something slightly different, but perhaps bringing in my physiotherapy skills. I never thought I'd end up in digital health, although I had lots of interests that when I look back and reflect, I'm not surprised I've ended up on a very different career path. My job is very, very varied at the moment, and that suits me really well. I really enjoy doing different things. So a lot of my time will be spent engaging with the communities and the people that we serve. So for example, we've been running some focus groups this week, engaging with Muslim women communities and our deaf society in part of the region. And so we're really looking to get out to the people and ask them for their thoughts and ideas and get them to co-produce with us how we support them to become digitally activated. One thing that has been really key for me is networking and finding the right people to help support me in the transition. So I think for clinical staff working in an acute trust or in a CCG in primary care, I think it's really helpful to seek out your Chief Clinical Information Officer, because that's somebody who's already working in a leadership role in digital transformation at sort of a local level. I think as well that social media can really help us to connect with the right people. I found that there were a lot of key people in the region that I started to follow and read what they shared and connect with on Twitter for probably about 3 years before I ended up in a digital role. And so once I met those people, they knew me and I knew them, and that helps to open up opportunities as well as helping shape my learning as I was on the journey. One of the other things I found really helpful is to volunteer with organisations that are working in this space. So I've become involved with the One Health Tech organisation, which has helped me to network. It's given me an opportunity to meet other people through the events that they run and to widen my network. I've also volunteered with the World Health Innovation Summit, supporting delivery of community-led health and care support for the health and care system. And I think that has helped widen my network quite considerably and exposed me to new literature, new material, new organisations that have helped me to get a bigger picture. The one thing we can say with certainty about digital technology is that it isn't going away. It's transforming the way that we live our lives generally. We're just not quite up to speed with how we use it to support our health and well-being. There's some great technology on the horizon and being used in clinical practice at the moment, such as virtual reality and artificial intelligence and machine learning are used to support the decisions that we make. But at the heart of it all is making sure that our patients and our public and our frontline staff and clinicians are empowered to do things in a really productive and meaningful way that helps to support them.